Hi. So I'm going to talk about lower eyelid blepharoplasty, which is one of my favorite procedures, and my triplanar lift, which I've been doing for close to a decade now. It's my go-to favorite procedure for it if the patient's the right candidate. So most patients will come in, say their eyes look tired and they need to have something done for it. They'll have usually some type of bag or fat bag or sort of a prominence over there, and then some kind of hollowing. So I'm assessing skin texture, I'm assessing contour, whether that's an elevation or a depression, and eye prominence, how far the eye is sticking out, because that would determine also the amount of support the lower eyelid has. All of this has to be done at the same time during the evaluation. Of course, every patient, we look at the old photographs just to see how the aging process went and try to reset it as much as possible. So for patients with prominent eyes or sort of semi-prominent eyes with a negative, it's called negative vector or something, where they have in their midface there's less volume there. I like to do this triplanar lift where I'm actually in 3 different planes, tissue planes I'm addressing. So that's why it's triplanar. I'm addressing the fat layer on the inside by removing some of the fat from the inside of the eyelid by making that transconjunctival incision. I fat graft a ton on these. A lot of the patients are getting fat grafted. I love fat grafting because it's a very natural way of replenishing the volume from the mid-face up to allow that transition zone between the cheek eyelid junction to sort of be lessened, and that gives such a nice natural appearance. And then, of course, on the skin surface, I'm either skin pinching, lasering, or chemical peeling, but most commonly CO2 lasering. I think that's the greatest sort of textural advantage that we can get. And so that's sort of the evaluation part of what needs to be done. And then sometimes I need to go through the skin and tighten and excise some skin, or sometimes I need to support the lower eyelid with some tightening. But the most common way I do this procedure for lower eyelid blepharoplasty is that triplanar lower eyelid blepharoplasty, where I make that incision scarless through the inside of the eyelid, remove some of that fat, sometimes transpose it down to the midface if there is enough to transpose. But almost every case I like to do some sort of fat grafting to the area there so that I can address the cheek eyelid junction and then resurface the skin. So what to expect the morning of surgery? Um, it's a boutique practice. There's nothing else going on at that time except for your surgery. So I'm fully focused on your surgery. You come in, you sit down, and the two of us will have a conversation. The conversation will be me asking you to repeat what the surgery is. That's my way of knowing that we're on the same page. Then I fill in the blanks and we go over the steps of the surgery. At that point, I might need to mark you. Um, I I usually have you ahead of time note not to put any moisturizer on your face because the marking pen doesn't stick well to it. So I mark you very carefully. This is the part that takes me the longest because measure twice, cut once is a great way to sort of view things at the morning of surgery. So I definitely will measure and evaluate it um, a lot and then mark you. We'll answer all questions. You'll meet the anesthesiologist. Obviously, the surgery center, the operating room is in the office. So my nurse Leanne will take care of you and then take you to the back to the operating room. And we'll start initiating the anesthesia, and so we can start the case. Um, Prior to the surgery, the night before, there's no eating or drinking after midnight unless you're taking some predetermined pill or medication that you need to take. I will have asked you to stop anything that can thin your blood, like Advil, aspirin, Motrin, or vitamin E, or any type of blood thinning agent. I usually like to advise patients to start an anti-inflammatory based diet. And for me, that's a whole food plant based, sort of heavier based diet, and cutting out sugars and carbohydrates leading up to it, a week or two before. Interestingly enough, a lot of patients feel better on that diet and tend to continue it, like I do, but not necessarily after a week after surgery, sort of go back to activities. If you wear contact lenses, I'd prefer if you not wear it, take it out if you are wearing it. And then you can't wear it for a week after surgery, so please have glasses ready. There's no bandages coming out of here for eyelid surgery. There might be stitches for the upper eyelid, but generally they're pretty they're pretty well tolerated. Let's talk about the aftercare. Specifically interactions with the office. So we call you after surgery. We will obviously be in touch with you. I see you a week later, 5 to 7 days, let's say, and that's just for evaluation, suture removal, things like that. You can go back to exercise activities 3 weeks out, but you can certainly start walking out in your neighborhood within a day. As long as you're covered from sun, I'm okay with it. The first 3 days, you have a lot of homework. You're icing or cool compressing every hour while awake for the first 3 days for 15 minutes on the hour. That's pretty helpful. Not while you're sleeping, just while you're awake. You can watch TV if you're comfortable reading on the computer, that's fine. Usually we give you some kind of antibiotic drop, antibiotic ointment. There's oral antibiotics, and provided that they're not contraindicated. Very few patients complain about pain afterwards. It's a very well tolerated procedure. I usually see you a week later, then a month later, then 3 months later, 6 months later, and a year later. So I'm following the progression of the surgery as it heals and explaining to you the healing process and reminding you of it as it goes. Everyone heals at different rates, so there's some tolerance within there. Thanks.